We're going to go ahead and get started. And what we're going to do today is we're going to talk about how these different types of products interact in the industry. We're going to give you some information that you need to be able to understand how to go in and clearly review and understand what this equipment does so you can pass those exams and get up and running with this fabulous piece of equipment. One of the things you want to look at is what's on the screen here. This is provided for you with the WAVE 4000 and 2000 to give you a clear understanding of everything you need to know about these particular products. This is a PowerPoint presentation that's available when you get your information about your registration. In addition to that, we also have the human anatomy video or PDF that is extremely powerful and gives a complete understanding of the anatomy of the body on a rudimentary level. And it's important that you understand the basis of this particular stuff because it really helps you understand more about what the body's doing, the muscle structures, the bones, the blood, your organs, and many other aspects that are critically important to get a good feel of just the body in general as it reacts to our types of equipment and what causes the types of response that we get. So with that in mind, we'll be going through that as well. But currently what we're going to do is we're going to start off with the WAVE 2000 and 4000 and understand that we have products that deal in the standard traditional world of TENS as an example. TENS means transcutaneous electrical nerve stimulation. This particular identification gets confused with a company that actually utilized that name at one particular point in time as part of their system. But it is a form of electromuscular stimulation. Now the units that we use, the WAVE 4000 and 2000, they are literally multiple wave form products. They do electromuscular stimulation, which is identified as EMS. They do Russian stem, which is a patented system that came out about 15, 20 years ago, give or take, that very clearly increases the power of your electromuscular stimulation. There's inferential, which is IF in its definition, and it is an inferential current in itself and has specific functions. And then you have the TENS, which is transcutaneous electro nerve stimulation. Those are the four types of currents that are available in the WAVE 4000 as an example. Now, in addition to that, we have the WAVE 2000. The WAVE 2000 also has, of course, EMS. It does not have Russian stem. It does have TENS, which is the TENS, and it has inferential current. Now, it has something that the WAVE 4000 does not have, and that is very simply microcurrent. It's designed more for working within brain waves and other types of systems such as that. So there's a series of different breakdowns on these units that really make a difference. But when you look at like microcurrent itself, you must realize that the only place that microcurrent is found in these two units is that WAVE 2000. Now, on the WAVE 4000, the WAVE 4000 is pre-programmed. It has options for a variety of different possibilities that the doctor can choose for his patients. And the total number of pre-programmed options is 50. And it's important that you understand that there's this many different types of options available because you have so many different modalities that the doctor needs to understand. Now, there's a series of books that comes with this equipment as well. So you'll be able to understand all of this stuff in more detail. There's training and there's video training potentials. There's a number of things, but the bottom line is that is the number of options that are available, and that's 50. Now, When you look at the benefits of using waveform therapy, you want to be aware that the benefits include, as an example, maintaining or increasing range of motion, relaxing muscle spasms, muscle aches and pains caused by stress and how it deals with those, and it, of course, increased blood circulation. These are important things that this equipment does. Now, as a matter of fact, our RMAC series, our high voltage low amperage electromuscular stimulators, do exactly the same thing. They have all of those same indications, and those are basic indications that are provided by the FDA registrations for the different units that are out there. Now, when you look at a TENS-based portion, the TENS section, TENS, of either the 2-port or the 4-port, that particular function is really designed mostly for just pain management. It's very important that you understand that that's really where TENS comes in. It uses a low voltage electrical current, not a high voltage electrical current, but a low voltage electrical current in its process. When you deal with the inferential current, it's also called IFC, specifically if you were looking it up. It's the most commonly used stimulation in the waveform therapy because it's comfortable. It's not discomfort is not disconcerting to the patient themselves. So it's one of the most highly used types of waveform. Now, one of the things that you need to understand is inferential can be used for acute and chronic pain, not just everyday, pain management, but acute and chronic pain. It's very important that you realize it can do that, because that's the system you'll use when people are dealing with neuropathy issues that are causing burning feet and excruciating pain and agony because the nerves are being affected. This will help with that. Okay? In addition to that, we have the Russian stem current. Now, what it's mostly used for is to really strengthen, and the word strengthen is a little deceptive. It's really to condition muscles. It does strengthen through the conditioning process, but it's really strengthening and conditioning muscles. That's what Russian stem really does. It does, however, by sheer process, help in the areas of pain management. But you must understand that it is more designed to deal specifically in the areas of dealing with that strengthening or conditioning of muscles in general. By that process, at a low level, it can actually help in the areas of neuropathy issues based on the fact that it pulses those muscles and releases them at a high level and helps to push the circulation through the areas that are having concerns and problems with circulation. Now, our RMAC series system is a high voltage, low amperage current, so it gets much higher in its voltage. And when it does that, very simply, it gets higher contractions, a little bit longer periods of time, and more importantly, bypasses the nerve to get right to that muscle. So as a result, by the sheer process of what Russian stem and at a higher level, electromuscular stimulation using the RMAC series, it can actually help a person who's even had a stroke or some other health issue that's eliminated the usage of muscles. It could even in an area where the spinal column's been severed or they can't use the lower leg, nothing's working. We take those types of people and we're able to help to condition those muscles so they can strengthen, therefore possibly increasing in girth by the sheer process of conditioning and strengthening. And by doing that, we're able to provide, even though the person can't use the limb, we provide a cosmetic increase in how they look. They look better. It makes them feel like something's actually succeeding, even though they may never be able to use the limb again. So again, Russian stem can help a stroke victim increase the girth of a thigh muscle, especially if you look at some of the studies that have been done on electromuscular stimulation using Russian stem, and of course a lot of activity on the RMAC, which is high voltage, low amperage electromuscular stimulation. You're going to see that this type of thing is something that happens all the time out there in the industry. It's used a lot by chiropractors and other groups to help in those arenas with neuropathies such as diabetic neuropathy and things like that. So now, when you're looking at these units, you have lead wires. Now, these lead wires will accommodate, on normal average, 2 electrodes. You plug one into each side, and those 2 electrodes are what you use to complete the current to a particular area. When you're dealing with your waveform therapies, your 2000s and your 4000s, a lot of times you will actually, in certain programming modes, inferential being one of them and TENS, actually go over the top of a particular muscle specifically. Whereas if you get into your Russian stem and your high voltage types of units, you're going to surround the muscle and then run the currents through to create the pulsing and get the result on the muscle without actually being on top of the muscle itself. But still, each wire has 2 electrodes. Now, you can actually increase that if you use what are called bifurcated leads, and each of the different products, the waveform therapy, the 4000 and 2000, and also the RMAC, have what we call bifurcated leads. They can actually take each side of the electromuscular stimulation and split it to where you get 2 electrodes on each side, so now you have 4 on one wire. Or you could even split it again, especially with Russian stem and with EMS. I wouldn't recommend it, and most people don't use it for TENS and inferential. But for dealing with Russian stem, EMS, and really the high voltage, low amperage, you can split those up to 2 times, creating a total of 8. I've even seen it done with 32. Again, it's not something you should ever recommend to anybody, but there are instances in rare occasions where those things can happen if the power is there. That will happen mostly in the RMAC types of units that carry that higher voltage up to 400 volts. Now, on a Wave 2000 unit, of course, what you've got is you have 2 ports, which means 2 wires. That means that you could literally, for a person dealing with neuropathy, use 1 wire consisting of 2 electrodes on the right leg and another one on the left leg, because you're going to put one at the base of the foot, on the ball of the foot. Horizontally, you'll put one on the outside of the lower leg, right in front of the frontal bone, and then you'll run the pulse through there to help push circulation through the contracting and releasing of muscles using Russian stem or the high voltage electromuscular stimulation. Even EMS to some extent will do that. A 4000, a Wave 4000, has 4 sets of wires. So you can do a number of additional locations. And you can do different areas of the body simultaneously. You're not limited to doing one type of therapy at a time. Okay, and a lot of doctors do that. Now, the RMAC 2000 that's coming out and the RMAC 4000 also use the same wires, and they use the same types of wires. Now, they look a little different, but they are basically the same, and the electrodes that plug in are basically the same. Okay, our electrodes really are a very good quality electrode on the high voltage electromuscular stimulators, and they have a really nice metal mesh that's inside that helps to conduct the electricity more efficiently. So our electrodes are a little bit more expensive, but they're far, far better for the client overall and for the person that's doing the individual work on that particular client. But again, there are 4 wires on an RMAC 4000. There's 2 wires on an RMAC 2000, same as there is on the Wave 4000 and the Wave 2000, respectively. Now, when you're looking at trying to analyze how the WAVE system functions from a medical or a non-medical standpoint, because there's two different areas. One is medical in the sense of medical doctors that carry insurance, do insurance reimbursement. There's ancillary products that are available to help them do a better job for patients, and there are billable codes in the areas of this type of therapy that are available. You also have the chiropractic side, which has different types of codes, more generalized codes. They're much more limited, and they are not able to get reimbursed in the areas of Medicare and other types of programs through the high voltage electromuscular stimulation, but they do have some options on the WAVE 2000s and 4000s. Now, when you talk about a chiropractor, as we mentioned it a little bit earlier, you know, insurance from Medicare, the most important thing that you need to understand is, in general, for the process of the types of coding that will be done for therapy, the chiropractor cannot bill on those particular types of codes, period. A doctor can do therapy. They can do many different types of programs. They can rent equipment, and Medicare will reimburse those things as well as the other insurances. But from the Medicare side, a chiropractor cannot do that. Now, you have to look at what doctors can and can't do. This is equipment that a doctor can sell to a patient, okay? That's sold through our company, however. So the basic concept says, look, the doctor can't sell the unit, but the doctor can recommend the unit, and we will sell the unit to the patient under the proper systems, okay? As far as insurance from a Medicare, as far as paying for waveform units through a doctor, and Medicare is how they pay it, the doctor themselves will not be able to get paid for somebody purchasing an electromuscular stimulator from them through us or in any other way, unless it's been prescribed. There's a series of things done with physical therapy people and a number of other areas that are there, and it's very important that you understand that clearly. Now, when you have a rep that is using a waveform therapy product, our 2000 or our 4000s, or the high voltage electromuscular stimulators, the RMAC 4000 or 2000, very simply, that individual rep cannot, under any circumstances, do anything but demonstrate the unit. They cannot treat, they cannot charge, they cannot provide sampling. They can demonstrate the unit and what its capabilities are. From there, the patient has to make a decision on what they want to do, and in all electromuscular stimulation units that we carry, a patient cannot buy one of these units at any time from a rep, from our company, or in any other way without a recommendation, an actual virtual prescription, although it's not designed as a prescription. It's a required use or a recommended use form. But the fact of the matter is that it must have a form in order for that patient to be allowed to use it. So if they come in, they want to buy your unit or that you have as a demo, and you want to sell that to them, they have to have a doctor's permission, and that has to go through the company so that we can control that that's occurring. That's an FDA requirement. Cannot be sold without a medical professional's recommendation or recommendation form. Now, a lot of people ask these questions very clearly on electrodes. One of the biggest concerns they have is how expensive they are and how long they last. And the bottom line, if you want the equipment or the electrodes to last for a long period of time, it's very important that you use a very simple process, and that is get yourself some hydrogen peroxide, and you mix it literally 2 parts water, 1 part hydrogen peroxide to be specific. It doesn't have to be exact. But when you do that and you're finished with the electrode, you spray the electrode gently without drenching it. put it back on its plastic. One, you're going to keep it clean, and two, you're going to get it to last a lot longer. We've seen them last 2.5, 3 months. Traditionally, you can see 1 to 2 months on an electrode. However, although it's not absolutely required, it's highly recommended that when a doctor or anyone, you as a person doing demonstrations, if you're a rep, if you in fact are doing those demos and you've got multiple people that you are actually doing the demos for, you should probably use separate electrodes for each one. Or for sure, at least on the demo side, when you're doing a lot of demonstrations, make sure that they're nicely clean and that you rotate them. So there's 3 or 4 or 5 of them sitting there, different sets. So you can allow them to kind of dry a little bit on the plastic in between usage. And so you can revolve 4 or 5 of them. I've used as many as 10. And that'll keep you keep the stickiness to those electrodes so that it will function more completely. Now, again, everybody, when you look at the world of electromuscular stimulation, you've got to understand, although there's not a heck of a lot to it, it's very specific. You have to be able to follow the indications that are involved with those units. And when you're doing that, you want to stay right within what we talked about a little bit earlier, and that is the indications that are allowed by the FDA. And the FDA is very specific, so I'm going to repeat them one last time. It's to maintain or increase or condition and to increase range of motion. They're designed to relax muscle spasms, muscle aches and pains caused by stress, and to increase blood circulation by the process of pulsing and releasing the muscle groups. Those are very, very important basic indications that you can talk about with this unit that are covered in the FDA clearances. Other than that, remembering not to treat a patient ever, because it'll put you in tremendous liability as well as a company or anyone else. As a medical rep, we want you to be certified. If you're not certified for this equipment that you have and you're not going to be selling the equipment, we highly recommend you get a medical recommendation from your doctor because you want to make sure you're using the equipment correctly. You want to read all manuals that come with the system to understand the limitations, the restrictions. As an example, you don't want to treat a woman that's pregnant down in the waist areas where you could potentially create contractions. So the bottom line is you have to be very careful there. There are indications with the pacemakers and other things that are there that you need to understand. The way you understand those is to read those in those books, to read the information, to study the PowerPoint presentations and get a better understanding additionally of all the things you need to understand about these units. And then lastly, once you've got a clear understanding of what these units are designed to do, what you can and can't say, you still have to deal very specifically with the areas of billing. Now on this particular product, it's very complex. So you must, without question, be consulting with the office if you're going to start quoting billing on electromuscular stimulations to doctors and to chiropractors. You set up a time or you send in emails, you get our billing department in touch with their people so that they can effectively talk about this intelligently, because there's a whole heck of a lot of rules and regulations that come about with electromuscular stimulation and how it's billed and how long it's billed. And if you say the wrong information to get a product sold, you're going to have real ethics and compliance problems like we talked about yesterday. So don't quote anything you don't know or you don't understand. And understand that our billing department is designed to help the doctors with that. And they're not going to talk about what it takes to make the sale. They're going to talk about what it takes to be in compliance, to make sure they're not breaking any rules, and how to make sure they're getting reimbursed without any monies having to be given back. So that's the entire concept behind what our billing department is designed to do, is to help avoid those kinds of problems for the future. All right, so that it covers right now the overall wave therapy and electromuscular stimulation certification system. Take some time, review this webinar, and get a clear understanding of all the things we discussed on it. It'll help you a lot in working through the certifications here. Now, we're going to talk a little bit about human anatomy, and I'm not going to get into a lot of areas, but I can tell you this, unequivocally, unless you look at that human anatomy PowerPoint presentation and study it all the way through, which is a little time consuming, but it's important. If you're going to be in the medical field, you better understand what the medical people know and the non-medical people, because remember, muscular and skeletal is also chiropractors and osteopaths and other groups. Okay? It's also designed in massage and spas and wellness and acupuncture and a whole series of other areas, all of which apply a lot into electromuscular stimulation in both the TINS, the inferential, of course, the EMS, the microcurrent, and the Russian stent, not to mention our high voltage, low amperage, RMAC units. But understand, there's a number of specific questions that will be asked on this test that just plain, unless you've had an education on the human body, you will not be able to answer if you don't study the presentation. You've got to look at blood forms. You got to look at what types of blood cells are, really located in the body, okay? And you have to look at like bone marrow and what types of blood cells are there. You have to look at the skeleton and understand how the skeletal system functions, what part of the body is, what does it represent, how much does it represent. You got to talk about joints, okay? And you have to understand what the different types of joints are, okay? As an example, what's the most movable joint in the body? In that particular case, you have to look that up and you have to study it. It's a synovial, to be specific, but it is the type of thing you need to understand. You need to be able to see why it's more movable, why these things take place. What is a band of fibrous connective tissue? These are the kinds of questions you're going to get. Now, I'm not going to go into detail, and there's no way to really go through this other than to explain to you that in order for you to understand the human body, take copious notes on that PowerPoint presentation. When it says that, as an example, a very movable joint is this synovial joint, write it down. There's the question. What's the answer? And do this with every area of that PowerPoint that's specific in what it's talking about, because you'll probably be using it. Now, will you be doing a lot of discussions with this with your doctors and other people? Not necessarily, because you don't know. There will be indications where you are, and I guarantee you, if you don't have this knowledge, you could lose a sale as a result of it. So I recommend that everything you think is important in questions, any statement that's made that sounds finite and something you would think you would need to know, write it down and put the answer. And then study that so that when you take the test, you're in a position where you understand what it is that you're answering the questions to. You won't make it through that test without it, I promise you that. And there's no way for me to go through this today without actually just going through question after question after question. That does us no good at all, because you'll never learn it. You'll just write down the answers. And you need to understand how it functions, especially for electromuscular stimulation. So with that in mind, everybody, that is our presentation for the day. Very simple, very dry, very direct. But the fact of the matter is, you should be able now to go in, study this presentation here that's on the screen. You should be able to go in and look at the presentation that is on the human anatomy, which is very, very dynamic in the amount that it is. I mean, the total, I think, here is about 37 slides, very comprehensive. If you take the time to write down the things that are pertinent, You will do well on this test, and more importantly, you will do better in sales. But that's a choice you have to make. So from Renewa Medical, I want to thank you all for being on the call today. This recording, as the others, will be up on the OneDrive within a short period of time and be available to you. I recommend that you take these 2 different webinars right now, in addition to the introductory webinar, and that you review them in detail. Get a clear understanding of what was discussed on here. It will help you dramatically in learning how to run through, complete that certification, and more importantly than just passing it, actually learn all about the different aspects of what our equipment stands for in the FDA registration world, and what compliance is, what you can and can't do, and more importantly, how to sell it to the doctors by having the knowledge to answer their questions when they ask them. So from Renewa Medical, I want to thank you all for being on the call. We're going to go ahead and end the recording, and we'll end the session. And like I said, if you have questions, said it yesterday, said it the day before, support@renewamedical.com. Send your questions. Get answers. If you got billing questions, you need to provide that information to our support department, allow our support department to have our billing people get back to you or your client to help you. It's extremely important that you do this. If you don't, you're going to continue to chase down sales, and you're not going to see the results you want because you won't have the answers you need. But don't think for 1 minute that in any of these tests you're just going to skate through. If it was easy, nobody would learn anything from it, and we wouldn't know that they had learned, and we would leave our company in jeopardy at all times. So we've got a good number of people on the call today. I want to thank everybody for being on the call. And you have a great day. And tomorrow at noon, we'll be having the 3rd and final session for the certification that will take place that specific time. And there we're going to be talking in detail about billing as an example. We're going to do a little bit of work on that. And then we're going to talk about the final stages of this system in general and how to pass that test. We're going to talk about the RM3A in detail. This is going to be very, very comprehensive. So be prepared to take copious notes. You will not pass the RM3A course unless you do. You must study diligently. It's an extremely important part of your business with Renewa Medical. It is a very high-paying commission product, and it is extremely powerful to the doctors out there in the field because of its insurance reimbursement. We'll be going into some of those in great detail tomorrow. So everybody have a great day. I want to thank you all